Always look on the bright side of life. Always look on the light side of...
We're now looking at another managing stress technique. This time we're looking at stress inoculation therapy. Now, whereas the previous biofeedback was a behaviourist approach, this one is a cognitive approach. Okay, so we're thinking here about thought patterns. Now, what it's saying is that actually stress is caused by information not being processed correctly. So there's some kind of cognitive issue in the way thoughts are being processed, and by changing that, okay, we can reduce the amount of stress that's being experienced. So, an example here. If somebody is stressed, maybe suffering from anxiety around an exam or in an exam, it's because maybe they think they won't do very well in it. Now, why do they think they won't do very well? It could be because they've been unsuccessful in previous exams. It could be somebody is telling them they won't be doing very well. It could be they're just telling themselves they won't do very well. But there's some kind of reasons why they think they're not going to do very well, and that's causing them stress and anxiety. So how could stress inoculation therapy be used to help that individual? Okay, there are 3 stages to stress inoculation therapy. Okay, the first stage, you've got to actually identify what the negative thoughts are. Okay, so you would sit down, you would talk to that person, and you'd try to identify together what those negative thoughts are. For example, again relating it back to the exam example, telling themselves that they can't pass, telling them that they shouldn't bother because they're going to fail anyway, and other negative thoughts along those lines. Okay, so once you've identified what the negative thoughts are, you need to move on to stage 2, and this is where you're teaching them coping strategies. So here, the patient is taught relaxation techniques, okay, as a coping strategy for managing their stress. So that could be things like visualizing and thinking about being in situations that cause them stress, which is then followed by ways in which they can reduce it. So saying things like to themselves like, I have revised, I am fully prepared, I know exactly what I have to do in the exam. They might, as part of stage 2, take them to the actual physical environment where they're going to be to sit their exams, and they may practice deep, slow breathing there. Okay, so putting them into that stressful situation and teaching them how to relax themselves in that particular environment. Once they've gone through stage 2, they then move on to stage 3, which is actually putting all those techniques into practice. So it's putting themselves into the stressful situation. Now, in this case, that's sitting the exam. It could be used for a number of other things. For example, people who are suffering from agoraphobia, and when they're scared to go out into public places, to crowds, you might teach them similar techniques to try and help them be able to leave their house and go out into public. Okay, so they'd identify the negative thoughts, they'd learn lots of relaxation techniques, and then eventually they would put it into practice by leaving the house. Okay, they try to put in place all of the techniques, all of the strategies that they've learned, and hopefully that will reduce the stress and reduce the anxiety. Okay, does it actually work though? That's obviously the thing we're particularly interested in. This study is by someone called Meichenbaum, done in 1972. Okay, so the aim was to actually compare stress inoculation therapy with systematic desensitization. Now, systematic desensitization is something that we've looked at before when we were doing the Bandura study on snake phobias. So it's something you're quite familiar with. So I'm not going to talk about that in too much detail. So they had the stress inoculation therapy group, the systematic desensitization group, and then they also had a control group, just like in the Basinski study, where they were kept on a waiting list. Okay, so methodology this time. This time it's a field experiment. They used self-reports to assess some students who were their participants before and after the treatments, and they were assessed blind. Okay, the individuals who were assessing them didn't know which treatment they had been receiving. Okay, which is an important factor to increase the validity, increase the reliability of the data. It gets rid of any experimental bias that might be there. Okay, so who were the participants? Again, it's quite a small sample. You've only got 21 students, all aged 17 to 25 years, so you've got quite a small age range. They're all students, show from a similar background, but the advantages of that sample is obviously for the researchers, they're going to be relatively easy to recruit. Okay, and the sampling method they actually used was a self-selected sampling method, again, like Basinski. Okay, so at this time an advert went out for treatment of test anxiety, so anxiety in exams. Again, quite important they used a student group here because they actually will be sitting exams. If they just use the general public, they're possibly not going to be sitting exams in the same way. Okay, so design. It's an independent measures design again, and again, they sit just one of the 3 conditions, okay, and they were randomly allocated to these conditions. Each group had the same number of males and females, and anxiety levels were also matched across the group, so it's a matched pairs design here. Again, that's going to increase the reliability, get rid of some extraneous variables due to individual differences. So, what was the procedure? First of all, they had a baseline measurement taken, and this was a test anxiety questionnaire, okay? After they did that, because remember they had to match them on their anxiety, they were then allocated to one of the following 3 groups. So either the stress inoculation group, this group received 8 therapy sessions, which involved being given positive statements to say and relaxation techniques to use, as I discussed earlier in terms of the 3 stages of the stress inoculation therapy. The second group was the systematic desensitization technique. They received 8 therapy sessions, involving progressive relaxation training. So they were told to practice the relaxation techniques whilst imagining themselves in increasingly more anxiety-inducing situations. Again, like in the same way as the snake phobia one was. The control group were told they were on a waiting list and they would receive therapy in the future. So, what were the results? Okay, the stress inoculation group did show the most improvement in terms of anxiety, okay, and in terms of the self-reports. So they had the most improvement, but there wasn't much difference between that group and the systematic desensitization group. The significant difference was between the 2 therapy groups and the control group, which seems to suggest that actually both therapies work in terms of treating stress, and actually any therapy seems to be better than no therapy at all in terms of treating stress again. So, what were the conclusions overall? First of all, stress inoculation therapy is a more effective way of reducing anxiety. Excuse me. In students who are anxiety prone, okay, so if they're going to have to sit an exam. It is more effective than techniques such as systematic desensitization, although you do have to take that with some caution because the sample size was very, very small, and we don't know for sure that that wasn't just down to some individual differences, and they did show an improvement as well. But one reason they said that possibly systematic desensitization wasn't as effective as stress inoculation therapy is that it didn't include a cognitive element. Okay, so stress inoculation therapy is actually trying to change the way you actually think about something, so it's going to be more effective in the long term than the systematic desensitization. So, as with all the core studies, you again need to think about evaluations. So, are there issues with the sample? Okay, can you generalize it to other types of anxiety? This was just focusing on anxiety around tests. What about the methodology used? What are the strengths and weaknesses there? Controls, there were quite high levels of controls there. It was a matched pair design, okay? They were matched on gender and anxiety levels. What about demand characteristics? Again, the participants are going to have been well aware of what the aims of the experimenters were. How, therefore, did they play into that? What about the ethics? There was a control group there. What about their anxiety and being treated? Think about the effectiveness. Think about the ecological validity. Okay, you can also relate it to some of the bigger issues. Is it reductionist? Is it holistic? Probably quite reductionist. Is it an individual or a situational explanation? Stress inoculation therapy addresses the patient, okay? It doesn't pay much attention or doesn't explain the behaviours in terms of the situation or experiences, and therefore this very much falls on the individual side of that debate. And finally, what do I want you to do? Okay, so you need to make sure that next lesson you bring along your evaluation for both the Basinski and the Meichenbaum study. Okay, it doesn't need to be written out as kind of full paragraphs, just the table, an evaluation table with strengths and weaknesses is absolutely fine, but you need to make sure you've thought about that, you've written it out, and you bring it along to next lesson with you. Okay.
Always look on the bright side of life. Always look on the light.